of you are able to see ear on the screen? So the next question what we have is ear, isn't it? So the two middle ear is asked. So again, middle ear also can be an essay question. In fact, contents, boundaries, and applied aspects of middle ear is the question now. So when you just look into the ear, basically we have three parts in ear. Like we have external ear. Okay, then we have, this is the external acoustic meatus, which is the part of external ear. Then this is middle ear. So the middle ear is like a box which has 6 boundaries. Okay, what are the 6 boundaries? It has, just imagine with your room where you are sitting. It has roof, it has floor, it has anterior wall, it has posterior wall, it has medial wall, it has lateral wall. So middle ear will have 6 boundaries. Okay, the roof is this, floor is this, near to the midline is medial wall, away from the midline is lateral wall. Laterally we have tympanic membrane, and medially we will have internal ear connection. Okay, and if you just see the middle ear cavity, we have 3 ear ossicles: malleus, incus, and stapes. Okay. Now see here, beta, the boundaries we should know, isn't it? So middle ear, I told you, it is like a box. So we should know like what are its boundaries. No, so it has, what are the various boundaries it has? It has roof, it has floor, it has anterior wall, it has posterior wall, it has medial wall and lateral wall. So how is the lateral wall formed? The lateral wall is formed by tympanic membrane. It's a partition between external ear and middle ear. We have tympanic membrane. So the tympanic membrane is actually the, like you can see, it is something like round or oval in shape. The diameter of this is 1 centimeter and thickness is 0.1. It lies obliquely like 55 degrees to external acoustic meatus. That means it is tilted outwards. Okay, so you will see we have 3 ear ossicles inside, no, malleus, incus, and stapes. So handle of malleus will be holding it in the center, so which will produce a projection which is called as umbo. This is handle of malleus. Because of the handle of malleus, you will see some concavity is produced which is called as umbo. I am talking about tympanic membrane because tympanic membrane forms the lateral boundary of middle ear. So tympanic membrane itself can come as 3 or 5 marks question also. So this tympanic membrane, so should I show you once again tympanic membrane? This is the tympanic membrane which is separating the external ear from middle ear. Okay, this is the handle of malleus which is holding it, making it more convex. This point is umbo. Okay, so this whole thing is tympanic membrane we are talking about. So it has two subdivisions like pars flaccida and pars tensa. So flaccida is like you are finding we have two malleolar folds like anterior malleolar fold and posterior malleolar fold. Between them we have pars flaccida. Then this area is pars tensa, which is tightly stretched and which is attached to the temporal bone which is forming this ear. Okay, then the tympanic membrane lateral surface is concave, directed down. Lateral surface is the one which is facing towards external ear. Medial surface is the one which is facing towards bones. Okay, so lateral surface will be concave like this, whereas medial surface will be convex. So the maximum convexity region we know it is umbo, where we have handle of malleus. There you will see certain muscles are inside like tensor tympani and stapedius, and there is a nerve which is passing from here which is cauda tympani. Cauda tympani is actually a branch of facial nerve. So now when you look at this tympanic membrane, so from lateral to medial side, basically if you see something like histology, it is made up of 3 layers. From outside to inside, the layers are CFM, something like that. You try to remember. The outer layer is cuticular layer, middle layer is fibrous layer, and inner layer is mucous layer. Outer cuticular, intermediate, that is middle fibrous and inner mucus. Okay, then so nerve supply, simple nerves you can remember. It is supplied by vagus nerve and cauda tympani nerve. Blood supply, tympanic artery, you write because it is tympanic membrane. No, simple names I am giving you. Tympanic artery. Nerve supply, vagus nerve, cauda tympani. Blood supply, tympanic artery. Okay, so clinical anatomy is sometimes you will see there is middle ear infection which is called as otitis media. Okay, so in case of otitis media, you will see tympanic membrane will be ruptured and pus will be oozing out into the external acoustic meatus. Okay, that is. You these names you will learn in ENT. Now you will not understand. For just now, you just try to remember this is otitis media. Okay. Now coming to the other boundaries. So before I take you to the other boundaries, it's better I show you the real picture of ear. See, this is the ear, isn't it? So I told you tympanic membrane is forming lateral wall. This is completely inner ear or internal ear. Internal ear forms the medial wall. Roof is formed by middle cranial fossa, that is temporal bone. This part of the temporal bone is actually called as tegmen tympani. Okay, then floor is also formed by temporal bone only, and it is separated by internal jugular vein. Okay, so here this is the floor where we have temporal bone and the internal jugular vein. Okay, posteriorly to the ear you have a projection, that is mastoid process. Anteriorly we have studied this tube, auditory tube, also called as pharyngotympanic tube or eustachian tube, which connects the middle ear to the nasopharynx. I told you if there is any infection in the nose, through this tube it spreads to middle ear. Okay, that is. So that is an idea what will help you to understand this middle ear. So roof I told you temporal bone, and the particular part you call it as tegmen tympani. Floor is also temporal bone. It is separated by internal jugular vein. Okay, then anterior wall. So in the anterior wall you will see there is a tube, no, which is connecting nasopharynx to the middle ear. What is the name of this tube? Pharyngotympanic tube, also called as eustachian tube. Close to this you have a muscle called as tensor tympani muscle. In the anterior wall you have to list out all the structures in anterior wall: tensor tympani, eustachian tube. Okay, you also have branch from internal carotid plexus. Okay, then we have cauda tympani nerve. These are better you practice this diagram and write the contents in your own words. Anterior wall has all these structures. Now coming to the posterior wall. Posterior wall I said we have like this mastoid process. Okay, so here in the mastoid process area you will have an opening that is adductus to mastoid antrum. Okay, that is a passage which is leading from the mastoid process to the middle ear. Like you have passage from the nose to middle ear, there is a passage from mastoid process to middle ear. That is passage is adductus to mastoid antrum. The other structures we find in the posterior wall is facial nerve is coming and it is coursing from the posterior wall to the medial wall like this. Okay, so we also have pyramidal eminence and cauda tympani nerve in the posterior wall. Practice this diagram, you can write in your own words. Okay, roof I told you tegmen tympani, temporal bone, floor also temporal bone separating from internal jugular vein. Now coming to the medial wall, which is towards the internal ear, you will have two openings which is communicating middle ear with the internal ear. These two openings are round window and oval window. One window is round window and the other is oval window. Okay, then there is first turn of cochlea, like you have 2.5 turns of cochlea. So first turn of cochlea is actually called as promontory. Over the promontory we have tympanic branch of glossopharyngeal nerve. Okay, so all these structures we find in medial wall. So imagine middle ear to a room with 6 boundaries. It has roof, it has floor, it has anterior wall, it has posterior wall, it has medial wall, it has lateral wall. Okay, and what are the structures forming each boundary you have to write. Then you should talk about contents also. Contents, I told you we have three ossicles. No, what are those three ear ossicles we have? Malleus, incus and stapes. Okay, these are the three small bones which are called as ear ossicles, which are found in the middle ear. Apart from that, you have two muscles also, like tensor tympani and stapedius. Okay, so this is all about middle ear. So development embryology we are going to discuss later. What are the branches of external carotid artery? Any four names only is asking. You can write superior thyroid artery, we have studied. In parotid
Facial
gland,
artery.
we found certain arteries. You should recollect those names. There we studied maxillary artery, superficial temporal artery, isn't it? So, whatever branches like external carotid artery, it gives lingual artery. Four names you can remember: lingual, superior thyroid, whatever are easy for you. Then maxillary, superficial temporal. Okay, because these names we have studied. Lingual we studied with tongue, and superficial temporal and maxillary we have studied inside the parotid gland. Superior thyroid we have just studied when we were doing thyroid gland, isn't it better? Those four branches you can study for external carotid artery branches. Implantation is embryology. Osteocytes, so this is part of histology beta. Osteocytes are nothing but one osteoblasts are bone forming cells. Once the cells are forming bone, they become inactivated and they get trapped inside empty spaces called as lacunae. These trapped cells are called as osteocytes. Visual cortex we will study with cerebrum when cerebrum comes as an essay. So visual cortex we have functional areas 17, 18 and 19. Okay, so boundaries of digastric triangle. See, anterior and posterior triangles we will take as essay questions. Okay, nothing to worry. Okay, beta. So we will stop here. So all so many essays. So it has taken a long time. In fact, today. Okay, so I'm stopping here. Almost 2 hours it was today. Okay, beta. So we'll.